Hello there, and welcome to your Bowen Therapy Whole Body Balancing. My name is Calliope, and I will be taking care of you today. How are you doing today? Okay. I hope by the time you leave this session you feel even just the littlest bit better. So tell me a little bit about why you came here for this Bowen Therapy session. Do you have any particular pains or concerns you want to address at all? Okay, and what do you know about Bowen? Okay, if you wouldn't mind, I'd love to tell you just a little bit to start, but we'll get into it more during the actual session. Okay, so Bowen Therapy was started by a man named Tom Bowen in the 1950s in Australia. It is a holistic or a whole body, not just addressing symptoms, but addressing the entire body kind of manipulative therapy. We work with fascia primarily. That is the connective tissue that, connects everything. It's mostly made up of collagen. And collagen, if it's not properly hydrated or if it gets stuck, then we can get a lot of pain in an area where everything's kind of stuck together. It should be this sort of open layered webbing, if you will, but with sedentary lifestyles or injuries or not hydrating well enough, sometimes this doesn't quite go according to plan. So our job is to use special moves to essentially tell the body that an area is stuck and allow it to heal itself. It's extremely gentle. We're not forcing anything into place, but instead we're allowing the body to do its own work, to do it automatically. So oftentimes we will see tissues loosen or adhesions. We can even see scar tissue start to soften. You might see an improvement in mobility or posture. You might notice that your pain changes a little bit. We'll get into that a little later. So it is a very gentle, really effective process for addressing all sorts of complaints. I mean, everything from musculoskeletal pain to asthma, digestive issues, anxiety. It's really going to help just about anything. Okay? All right. So to start, we are going to have you lie down, face down. This can be done over clothing, so you don't have to change it all. And we don't need to use a cover since you are going to be clothed. Okay? Alright, so from this point onwards, for the session, I am going to need to be touching you. Is that okay with you? Have your consent to do that? Wonderful. Thank you. So I'll give you just a few moments and you can get all set up, lying face down. Comfortable where you're at? Do you need any sort of pillow or support at all? Okay. If you find that you do, just let me know and we can fix that right quick, right? Okay, so we are going to start the treatment on the left side here. And we're going to start essentially the top of the hip area. And This is the area I'm starting. I'm just going to use my thumbs on this side and my fingers on the other side. So we are going to take the skin slack, challenge the soft tissue, and roll over. That's going to be our process. So I'm going to have you take some deep breaths for me, and I'm going to work with the cycle of your breath. You could just take a deep breath in for me, and out. Deep breath in and out. Good. And then we're going to move to just under the scapula. We're going to kind of bounce around from place to place. So, just right in here on the left side. Right there, okay? So we are going to take a deep breath in and out. Good. Deep breath in and out. Good. So that's going to be kind of our routine throughout the whole treatment. Now I'm going to work on the outside of the gluteus muscle here, so more towards the hip. And we've got right in the middle here. And we're just going to take the skin slack and challenge the soft tissue and roll it over. This particular spot we're going to do twice. So we're going to move a bit, stretch the skin, roll it back, just like that. On the other side, stretch the skin, roll it back, stretch, roll it back. And then we're going to move right in here, right on the outside of the hip, in and out. In and out. This is a very gentle treatment. We're just working in that superficial fascial layer. That's one of our Bowen mechanisms, is that we're not using forceful manipulation to address the body, but instead using the stretch, the fascia, and allowing the nervous system to communicate the information that we're giving it to itself. So now we're going to work on more the thigh over here. So we are going to do this in and out. And this is going to be more of a 3 times move. And a 3rd time. Using my index fingers here. and out, and out. Now coming down to the knee. We're going to work outside of the knee. I'm not going to be pressing or stretching in on the back of the knee. It's a pretty vulnerable area, pretty soft area. So we are going to stretch and roll over. The other side. Stretch. Roll over. Now, I'm going to come to the feet here. Just going to back up a little bit. So it's said that the original founder, Tom Bowen, he had quite a hearing impairment and he was quite deaf. And the treatments would be essentially minimal talking, except for his staff communicating with the clients. So he would just do these treatments in essential silence and leave the room completely with each 2-minute pause. With this type of Bowen work, we are using the time to go to a different part of the body so that the body can still work up here, absorb that information, soften, loosen, but we're still able to do work in another area. So now we're going to come up along the scapulae. So I'm going to come a little closer again so I can reach. And we're going to work up along the blade here. So I've talked about how the move works with the taking the skin slack, challenging the soft tissue, and rolling over. These are the steps that the Bowen move consists of. Third, fourth. So we are activating the stretch reflex, and that's one of our Bowen mechanisms. There's 7 in total. Work on the other side here. But essentially what we're doing is when we engage this stretch reflex, we are changing the information that the nervous system has been receiving from that area. And we're inviting it to take another look at what's going on and possibly to change. We'll get into the upper neck here. Our second of the mechanisms of our 7 mechanisms is joint proprioceptors. So when we're working over a joint and activating those proprioceptors, we are telling the body that this particular area needs to be normalized, that it needs to have another look and allow itself to automatically balance and normalize. So now we are going to go more on the inside of the scapula here. So in and out. Right in here. And out. In, out, in, and out. And then we can move to right under the shoulder joint here. So we are going to do a couple of moves here. And out. The third of our mechanisms is fascia, that we are working on the superficial layer of fascia. We talked about that we don't want to do forceful manipulations to try to work the body into alignment, but allow the body to do it itself. Right, and then we are going to go down the spine. We are going to do right up here. Just down each vertebra. These little moves here. Our next principle is segmental viscerosomatic spinal reflexes, which is kind of a mouthful. But essentially it means that the internal organs receive information based on what the nerves are picking up from the skin, from the muscles, and the nerves that we're working on. Now I'm going to be working more medially from the outer hip here inwards. We're going to take a bit of a diagonal direction here. Stretch and roll. Stretch, roll. 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 Stretch. Roll. Stretch and roll. Okay, I'm going to be lifting the leg and bending at the knee here. And we're going to work just in the crease of the knee. So we're going to go in and roll out. Give the ankle a little roll, and then just tapping the sole, just like that. Bend the knee here, support the foot, roll in, and then out. Roll the ankle and tap the sole. Good. So So now I'm going to work down the thigh, and I'm going to do this alternating my fingers. So we're not going to be doing the simultaneous, but this sort of inch walking down. We're going to go and down and down. Alternate each side. And ending right beside the knee here. Okay, and then I'm just going to lift the leg here, and I'm going to work down the midline of the thigh. So we're going to just like this. And then we'll repeat it on the other side. Go down. And we'll work the thigh here. Good. Looking down the midline. So we're going to work across the gluteus muscle, right out here, and work in. Good. Top of the hip. And then I am going to work up the back now. Stretch and roll and stretch and roll. So one of our other mechanisms of Bowen is the harmonic vibration and resonance model, which means essentially we are resetting the vibes and setting it up so that your body can be in harmony and balance. And then I am going to just take your leg here. We'll bend at the knee, support the leg. I'm going to turn it just a little bit out, and on the opposite scapula, on the bottom here, I'm going to do a couple of moves. Stretch, roll, stretch, roll. Good. And then we can work on the lower leg a bit. Bring the leg up, support the leg, and on the opposite side of the back, stretch and roll, stretch and roll. Let the leg down. And just work the back. Now I am going to have you turn over so that you are face up. And how are we doing in this position? All good? Do you need a support underneath the knees? Or maybe under the head here? Again, just let me know. So we are going to start along the back of the neck here. I'm just going to get a little closer. And we're going to do our Bowen moves going up the neck. Roll, stretch, roll, up the neck here. I'm going to work the side of the neck. I'm going to do this one side at a time, because this can be a little sensitive, like the back of the knee. Good. Work the first side and then the other. Okay. And then the strip in between the back and the side. Just work right in here. Just feeling around and letting the tissues loosen in this area. Right in here. And then let's work the back of the neck, both sides at the same time. Now we're going to come down along the rib cage here. So we're going to do some of that bouncing around a little bit again. So I am going to work down this way. So we are going to do 1, 2, 3, and 4 moves here. 1, 2, 3, 4. And then we can move to the abdomen. So I'm going to work the midline here. We are going to do 3 moves here. Stretch, roll, stretch, roll, stretch, and roll. Now we're going to work across the abdomen. We have 2 mechanisms of Bowen that we haven't talked about, and they're quite simple. Our second to last is lymphatics, which means that the work we do, some of the procedures we use, they have a lymphatic drainage sort of effect, and they can help stimulate the immune system. We're going to come down to the top of the knee and do 1 each. And the last one is detoxification, which means that the work we do helps the body, helps its function improve at a cellular level. And then I am going to just lift your arm here, and I'm going to work in the underarm crease a bit. So we will stretch and roll the skin, and then I will be working inside the upper arm. I'm going to use alternative movements with each finger and work down, and then turn to the outside. So first finger stretches and rolls, second finger stretches and rolls. Stretch and roll. Now we're going to do the forearm here. Stretch, roll, stretch, all the way down to the wrist. And then the inside of the forearm. After that, I'm going to work on the wrist, the hands. I'll pay special attention to the tendons between the hands, or between the fingers rather. And we'll allow everything to loosen up. We'll talk about this a little bit with your aftercare information, but there's an interesting phenomenon that happens where we work on an area that had pain and all of a sudden it shifts somewhere else. So that might be something that you experience. And it just means that the body is reprioritizing what needs the most healing, what needs to be focused on. The body is excellent at multitasking, but more on an unconscious level. There are only so many things that it can keep track of that we also know it's doing. So I'm going to take your arm here. We'll work in the crease for one move, and then we'll work on the upper arm. We'll do our alternative finger rolling movements to the elbow. Turn the arm and work the inside. Turn to work the outside of the forearm, our posterior forearm here. And the inside forearm. And flip it over so that we can work on the hand and the wrist. Then we'll be doing a little jumping again. We'll work on the hips and the legs. We will get into the head and a little bit of the face. We'll let everything else marinate with our little adjustments, with the information we're giving the nervous system. Good. So let's work on the outer hip. We are going to be doing 2 moves here. In, out, in, out. Out. In and out. And then we are going to do what I call making the leg into a triangle, in which I am just going to arrange the leg so that the knee is bent. We have this sort of triangle shape going on here. And then we're going to work the calf and alternate our moves here. And then we'll work the shin just alongside the shin here. Good. We'll do our triangle on this side as well. There we go, right there. Work alternatively on the calf. And then down the shin. And then just look at the foot here. So I'm going to come back just a little bit. We can work on the ankle. We are going to work on the face. We can work the upper part of the face, just coming back to the back of the head. And we only work on this upper part of the face, no lower than the cheekbones for this particular procedure. And then I'm going to stretch your arm over your body. I'm going to tap against the shoulder joint here, just like that. And then I am going to work a little bit more around the shoulder and the upper arm area in here. Stretch this arm and tap. And we're going to work on the abdomen a little bit more. So we're going to work upwards. 1, 2, 3, 4. 1, 2, 3, 4. And right along the mid-lower abdomen here. And then down the thigh. More. 5. Then we're going to make one of our triangles here. And I'm going to work on the hip joint, and I'll keep your knee secure here. We're going to work in to out. I'm going to straighten the leg and very slowly allow it to go down. Make our little triangle here and work inside, outwards. Usually we work outside in. This is one of those where we do not stretch, roll. Straighten the leg and very slowly let it come down. There we go. Now, I am going to be working on the front of the neck. We're going to do 3 moves here. I'm going to work 1, 2, 3. And then I'm going to have you take a curled index finger and put it between your teeth. This sounds very strange, but it's going to open up the masseter muscle and the TMJ joint here so that I can work in a little bit there. Alright? So if you could just bite down on your finger there. Good. And then just work in the jaw area a little bit. Okay, and you can let go of your finger there. Alright, so that is our full body balance with the Bowen Therapy. So I'm going to give you a moment to just come back to the environment around you, and we'll talk a little bit about what comes next and what I'd like you to do for your aftercare. So how was all of that? Good. So we chit-chatted about it for a moment, but you might notice that where you previously had pain or discomfort, that it might shift somewhere else as your body reprioritizes what it needs to work on. And this is a good sign. That means that it's noticed what was going on and has either fixed it or is working on fixing it. Now, most people need 2, 3, 4 sessions to address the entire body. And then after that, you pretty much should be good. You don't need to come back unless you want a maintenance session. But in the meantime, I would like you to really hydrate. This will help keep the fascia nice and moisturized so that it doesn't get stuck again, so that it's not all tightened up. And also getting a lot of exercise to keep the tissue moving will also help it from sticking again. Okay? All right, any questions for me at all? Very good. So I'd like to thank you so much for joining me for this Bowen Therapy session. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day.